Hello guys, so my today's topic is breath holding spells. So now we can see that what are breath holding spells. Breath holding spells are involuntary episodes during a child stops breathing for a short time, usually in response to triggering event like frustration, anger, pain, or fear. They are not deliberate or not harmful in long terms, but and also it is not under the control of the child. So basically, in breath holding spells, child will stop breathing and can't take the inhalation exhalation properly in the rhythmically. It occurs in otherwise healthy children. In healthy children, also this occurs, and usually it seems in between 6 months to 6 years, and the peak around 1 to 2 years. It affects 4 to 5% of the children. The children who will take birth recently, the 4 to 5% of the children get affected by this. The last episode lasts for seconds to a minute. This will took few seconds, and even in few minutes it will recover. So now you can see the types of breath holding spells. First is cyanotic breath holding spells, which is most common, and almost 70% of the children get the cyanotic breath holding spells, which will trigger from the anger, frustration, and crying. The sequence is the crying, a child crying vigorously, exhale forcefully, and stop breathing means the child will take inhalation slowly, but at the time of exhalation, the force of the exhalation is so much high and suddenly also stop breathing. Child will stop breathing suddenly also. If the turns blue around the lips and faces due to the lacking of the oxygen into the body. The face, the lips around the area is becoming in blue color. May become lips or lose consciousness. Due to the stopping of breathing, child may also get unconscious. The causes is sudden expiratory apnea, means the stopping breathing after exhalation. Means if in the rhythmically, first when the child take inhalation, then exhalation. But after this exhalation, child cannot take in again inhalation. Means the rhythm will stop in the between. After the exhalation, no again inhalation will occur. So this causes the cyanotic breath holding spell. The second type is failed breath holding spells, which is mainly less common according to as compared to the cyanotic breath holding spells. This occurs in 15 to 20% of the children, which triggers sudden pain or fright. Means the flight and fright movement. In that the sudden pain or fright movement will occur. Example: hitting head or getting a shock. By this, the failed breath holding spells will occur. The sequence for that is child may gasp or cry briefly or not at all. Means if the child will cry like a little bit or too much will cry or even the child will not even cry sometimes. That it turns pale means the child will turn pale, may lose consciousness again, same because of the oxygen lacking in the body. The child may go unconscious, can have stiffing or jerking, like seizuring like movement means the if the oxygen will not come under in the body completely properly, the amount which will needed, the seizure type movement will occur. Now the causes of that is vagal overstimulation, which will also has bradycardia, means the slow heart rate. Due to that slow heart rate, the bradycardia will occurs, and brief stalls means no heartbeat. In some of the period of the time, the heartbeat will stop, and again the heart will occur, but the certain time the heartbeat will stop. Now the third type is mixed type. There's a feature of both, means cyanotic and phallic type. They are combined. This type is the combine of cyanotic and phallic type, which is less commonly diagnosed. Means so rarely this type will occur. So now we can see that this type of breath holding spells will affect the brain or not. So it will not permanent damage, but the development of the child will become delayed due to this. Even in brief convulsion occurs, they are not epileptic. Means it's not epileptic. The long times will not occur. The short period of time this will occur, but due to this occurring of the breath holding spells, the development of the child will delay or may also stop. the brain get enough oxygen as spells are shortly. Means if the spells are shorter period of time, like the breath, like few seconds, the inhalation or exhalation, which will stop in the rhythmically, will occurs again. Then the oxygen to the brain will get properly, else the child will not get the oxygen properly. Now we can see the causes and risk factor. Emotional response means the crying or fear. Genetic predisposition means the positive family history in 30%. Like the if the any family member in past any family member has this disease breath holding spells, then chances of that the 30% of the child will get these breath holding spells. Sometimes associated with iron deficiency like anemia, autonomic nervous system immaturity, fatigue, and overstimulation. This is the causes, or we can say the risk factor by which the breath holding spells will occur. Now we can see how can we diagnose it. So based on history and observation, doctor will ask that age of onset, how can we it triggers, like what is the source of triggering, like the shock or any traumas. Then the duration and appearance during the spells means the how long the spells will occur, and the recovery time. If this is the diagnosis, in the on the basis the doctor will give the treatment. Now if now we can see the investigation. If the chronic type, like if the severe type of spells will occur, then the investigation may also needed. The CBC and serum ferritin to check for iron deficiency. If the severe case will occur, then we also have to check the iron deficiency in the child. Now, the EEG, if seizure are suspected, means as I say in failed breath holding spells. If the seizure occurs in more highly phases, then the EEG may also given. Then ECG, if the loss of consciousness without warning means the any due to a sudden unconsciousness of the child, the ECG also given. Now we can see the treatment and management. The reassurance. First is the reassurance in which the educate and reassure the parents. We have to educate the parents how to do in this type of situation and the spells. The if emphasize that spells are beginning and self-limited means we have to tell parents that if the spells were treated in home only, then they will do fastly. Now, the second one is iron supplementation. We have to tell parents that the child will get the proper iron amount in the body of child. In the iron supplementation, low iron linked to more frequent BHS. As I say in the types that the iron deficiency will may cause the breath holding spell. So we have to maintain the iron level in the body of child. Even without anemia, iron therapy can reduce episode. Means we have to give iron repeatedly to the child. So even then, without anemia, child will not get the breath holding spells. The behavior management. Avoid reinforcing crying and tantrums with attention. Use consistent discipline and positive parenting tactics. Means not the parents will not give force to the children or may not give traumas or shock, sudden shock. That type of parenting is completely avoided in the like small children. During an episode, stay calm, lay children flat and turn to side. Don't shake or slap. No need of CPR unless spells is usually prolonged. Means this word is the point in where the if the child gets the episode of the spells, the parents what to do in this situation. So first, stay calm. Second, let the child become flat in ground and turn to recovery position. And in mid-time of the episode, do not shake or slap the child. The fourth one and compulsory or mandatory point is no need for CPR unless the spells will become prolonged. Means you can have to wait for few seconds, few minutes, but if the prolonged period of the time spell will occur, then only CPR will given. Else the CPR is completely prohibited. So these 4 points is during the episode. Now we can see the prognosis. Spells usually stop by 5 to 6 years of age. Means 5 to 6 years of age, the spells are completely normal, or we can say treatable. But after 5 to 6 years, it may be the delay of development. We can have to see it seriously. No long-term complications. As I say that the spells will occur 5 to 6 years only. After that, long-term complication will not occur. Rare cases may need cardiology referral. Means if after the 5 to 6 years also the child gets spells episodes, then they have to go for the cardiological referral. So this is for me that I have covered the breath holding spells. Thank you. My name is Jalya Hitanshu from second year B Physiotherapy. I hope you can understand breath holding spells. Thank you.